Hello everyone, welcome to Yashoda Hospitals, the Health Talk session. Being too sweet can be harmful. Yes, diabetes is a manageable condition and if left untreated or ignored can lead to various serious complications. In India, millions of adults are being diagnosed with diabetes. So what causes it and what are the preventive measures one should take? Do post your queries on our social media network and we'll get them answered shortly. I'm Dr. Lakshmi and let's welcome Dr. Vighnesh Naidu, Senior Consultant Physician from Yashoda Hospitals, Secunderabad. Welcome, sir. So, sir, these days we have many young adults being diagnosed with diabetes. What do you think the reason could be for this?
A larger segment of the younger population is nowadays moving into the pre-diabetic or the diabetic area in terms of diagnostic findings. And clinically, most of them are also going into the overweight category or the obese category. Now, most of this is attributed to unhealthy eating habits, excessive consumption of junk foods and stressful professional and personal lives. So these do attribute to increase in blood sugar levels and people becoming overweight, which in turn leads to a rise in the acute inflammatory markers which we see. And this is attributed to the increased incidence of unwarranted diseases in the young.
So it's no longer that one should think that, okay, I can get diabetes only once I cross that age or something. So anyone could get diabetes at any age.
Yes, it is happening, especially given the current lifestyle which the population is leading. Yes, there's no age limit to diabetes.
So let's take few questions from our social media network. We have Mr. Kalyan. ఆయన అడుగుతున్నారు, నాకు షుగర్ వచ్చిందని ఎలా తెలుస్తుంది?
షుగర్ వచ్చింది అనేసి సాధారణంగా 80% మందికి ర్యాండమ్గా ఏదో ఒక పరీక్ష చేసినప్పుడు రొటీన్గా చేసినప్పుడు షుగర్ వాల్యూస్ ఎక్కువగా ఉండమని తెలుస్తుంది. బట్ మెజారిటీగా ఏ కారణం లేకుండా అలసిపోవడము, చిరాకుతనం ఎక్కువగా రావడము, చురుకుతనం లేనట్టుగా అనిపించడము, దాహం ఎక్కువగా వేయడము, ఆకలి ఎక్కువగా వేయడము, అవసరం కన్నా ఎక్కువగా తినాలి అనిపించడము, రైస్ కానీ కార్బోహైడ్రేట్స్ కానీ స్వీట్స్ కోసం కానీ కూల్ డ్రింక్స్ కోసం క్రేవింగ్ అంటే ఎక్కువగా తీసుకోవాలన్నట్టుగా అనిపించడము అండ్ మెడ చుట్టూ కొంచెం స్కిన్ నల్లగా అవుతున్నా కానీ చిన్న చిన్న పొలిపూరులు ఎక్కువగా వచ్చినా కానీ అవి షుగర్కి సూచనలు అనుకోవచ్చు.
So talking about diet, sir, what diet should one follow to avoid diabetes? Is there anything particular diet and from what age should one take these measures?
No, ideally we would suggest that we would avoid taking anything which is unwarranted or excessive to the body per se. So the amount of carbohydrates you take, the amount of refined fats you take and the sugary products should be at the bare minimal. Avoid excessive indulgence in desserts and ensure that you are able to maintain your calorie count as per your age and body weight within the normal parameters. You can always fix a day when you have a particular cheat day where you can indulge in what you would like, but that should not be on majority part of the weekdays.
So moving on to the next question, we have Mr. Chetan asking us from Karimnagar. He wants to know that both his parents are diabetic and he's worried if he could catch it.
Yes, that is definitely a possibility that if both your parents are diabetics, there's a 50% chance of you contracting diabetes by itself, but that's not purely only a genetic component which comes into it. A family that stays together tends to eat in a similar pattern. So the eating habits of a family also are responsible for whether one person gets a diabetes, at the age at which a person gets diabetes, and what is the severity or the extent of which the diabetes is there. So we would rather have to focus on the kind of food we eat, the frequency with which we eat, and the timings at which we eat. Physical activity and exertion is equally very important with good rest and less amount of stress in life. But that being said, if both your parents are diabetics, there's a 50% chance that genetically you might too develop diabetes. So you have to be all the more careful to avoid it or at least delay it.
So do you also have such questions in your mind? Do post your queries on our social media platform and we'll get them answered shortly. So moving on to the next question, we have Mr. Abhinav from Secunderabad. He wants to know how often should one get the diabetes screening test done?
There is no ideal age or a cutoff age from which you would start testing for diabetes, but if like discussed, if you have symptoms suggestive of diabetes, the ideal time is to get yourself checked at least once in a year, so that even at the earliest onset of the diabetes or the pre-diabetic stage, you can take lifestyle corrective measures through which you can address the issue from either going up or escalating to medications immediately.
So sir, are there any high risk factors to get diabetes?
Yes, we have seen an increased incidence of diabetes amongst the people who work in the night shifts, who have erratic eating habits, or who have highly stressful professional or personal lives. Apart from that, people who are also on the heavier side, the obese or the overweight category, also tend to progress towards diabetes. There is also a lean diabetic profile, in the sense that a person appears very slim, but he tends to have a little bit of a layer of a fat around the belly. So the externally under the shirt he looks perfectly all right, but he knows best that he's got a little paunch. Even that category of people, that is basically the area around which there's an increased deposition of fat, they are at risk of developing diabetes also.
సో సార్ ఎలాంటి చర్యలు తీసుకోవాలి డయాబెటీస్ కంట్రోల్ చేయడానికి ఆర్ అవాయిడ్ చేయడానికి?
సాధారణంగా రైస్ బేస్డ్ ఐటమ్స్ కానీ కార్బోహైడ్రేట్స్ ఐటమ్స్ కానీ మనం రోజుకి ఒక్కసారి కన్నా ఎక్కువ తీసుకోకూడదు. రాగి, జొన్నలు, కొర్రలు, పెసర్లు ఇలాంటి ఇంకా ఫైబర్ రిచ్ పదార్థాలు ఎక్కువగా తీసుకోవడం బ్రేక్ఫాస్ట్ కానీ డిన్నర్ కంటూ ఉండాలి. ఒక రోజుకి సుమారుగా 45 నిమిషాల నుంచి గంట సేపు వరకు కొంచెం దమ్ము కానీ ఆయాసం వచ్చే విధానంగా, శరీరం పైన ఒత్తిడి పెట్టే విధానంగా ఎక్సర్సైజ్ చేయాలి, అట్లీస్ట్ వారానికి 5 రోజులు. ఇలా చేస్తుండగా ఆ షుగర్ అనేది కాస్త పెరగడం కాకుండా బరువు తగ్గించుకోవడము, శరీరంలో ఉన్న అవయవాలకి రక్త ప్రసరణ పెంచడం ఆస్కారం కూడా ఎక్కువగా ఉంటుంది. సో ఇంటర్నల్ ఆర్గన్స్ని కూడా ఎక్సర్సైజ్ చేయడం వల్ల మనం కాపాడుకోవచ్చు.
నెక్స్ట్ క్వశ్చన్ we have Mr. Vijay from Anantapur. He is asking that for COVID infection he was treated with steroids and during that time his sugars were high. So will that be at high risk for diabetes?
Most clinically, when clinicians manage any COVID patients, especially with there is an elevation of acute phase markers or the disease is from moderate to severe category, we end up adding steroids because it is one of the life-saving medications in the management of COVID. Yes, we do see an increase in blood sugar levels, but normally not warranting any kind of medications in non-diabetics. But people who fall into the pre-diabetic range, their sugars tend to score beyond 200 or wherever it is, and it is then warranted that we use medications at least temporarily to keep the sugars under control. And it is seen in most of the patients that once we withdraw or taper down the steroid therapy, the requirement for such medication also comes down. So yes, if you were on steroids which are not very high in dosages and your sugars did go up beyond a certain value warranting medications, it's a good clinical indication that you are at risk of developing diabetes, but not because of the medication, but a pre-existing pre-diabetic ailment per se. And the effects of steroids are purely temporary and they are not continued for a long duration of time, especially among COVID patients, not exceeding beyond 2 weeks ideally.
Do post us your queries on our social media network and we'll get them answered shortly. So sir, talking about diabetes and steroids, what are the long-term complications one can expect when treated for diabetes?
The thing which most of the general public these days seem to be worried about is the usage of steroids, especially among diabetics, because diabetics tend to contract COVID-19 faster because of their lowered innate immunity when compared to the regular population. We see in the clinical setting that very anxious about the black fungus or the mucormycosis which is going around everywhere these days. What many people fail to understand, it is not a disease they would contract by using steroids at home. It does not spread from one person to the other person. Normally people who have very lowered immunity, people with grossly uncontrolled blood sugars, people with HIV infections, or people who required extensive oxygen support for a long duration of time. So this is the category of people in whom you see the black fungus or the mucormycosis going up. So their fears are falsely placed if they assume that they take oral steroids at home, managing at home quarantine, they would get the black fungus. So that does not cause it. So it is relatively safe provided your physician is able to taper the steroids appropriate to your marker values.
So moving on to the next question, we have Mr. Vasu asking us from Warangal. He wants to know if insulin is mandatory at some point in life when treating for diabetes.
ఇన్సులిన్ అనేది కంపల్సరీ అని అన్ని పేషెంట్స్కి ఉండదండి. ఇట్స్ ఓన్లీ ఎప్పుడైతే మనకి శరీరంలో ఇన్సులిన్ అనేది అవసరం కన్నా బాగా తగ్గిపోతుందో, లేదా అడ్వాన్స్డ్ స్టేజ్ ఆఫ్ డయాబెటీస్లో మన ప్యాన్క్రియాస్లో ఉన్న కణాలు ఇన్సులిన్ తయారు చేయలేనప్పుడు ట్యాబ్లెట్స్ వాడుతుండగా షుగర్స్ కంట్రోల్ అవ్వకపోతే ఆ కేటగిరీ ఆఫ్ పీపుల్కి మాత్రమే ఇన్సులిన్ని సాధారణంగా అడ్రస్ చేస్తాము. అది కాకుండా శరీరం పైన ఏ ఇన్ఫెక్షన్ వల్ల కానివ్వండి, లేదా ఒక సర్జరీ వల్ల కానివ్వండి, లేదా ఇప్పుడు కోవిడ్లో స్టిరాయిడ్స్ వాడినప్పుడు షుగర్ లెవెల్స్ పెరగడం కానివ్వండి, అలాంటి సిచ్యువేషన్ ఉన్నప్పుడు ఇన్సులిన్ వాడుతుండగా షుగర్స్ని ఇంకా ఫాస్ట్గా బెటర్గా కంట్రోల్ చేసుకోవచ్చు. ఇన్సులిన్ అనేది ఉట్టి షుగర్ కంట్రోల్ చేయకుండా కాకుండా అదొక అనబాలిక్ ఎఫెక్ట్ కూడా ఉంటుంది. సో బాడీని ఫాస్టర్ రిపేరింగ్ అండ్ రికవరీలో కూడా ఉపయోగపడుతుంది. సో ఇన్ హాస్పిటల్ సెట్టింగ్స్లో ఉన్నప్పుడు ఇన్సులిన్ ఇస్ మచ్ మోర్ బెనిఫిషియల్. ఎందుకంటే ఇంకా మా మెడికల్ ఇంకా పారామెడికల్ టీమ్స్ దాన్ని ఇంకా టైట్గా మానిటర్ చేయగలుగుతారు కనుక ఇట్స్ అ మచ్ బెటర్ వే ఆఫ్ హ్యాండ్లింగ్.
So with this lifestyle modifications and following strict diet, you think diabetes is a reversible condition, sir?
Yes, in terms of recently diagnosed diabetic patients, patients who are on the heavier side of the body weight, strict dieting, intermittent fasting, the so-called General Motors or the Ford diet, there are studies which in fact show that with good diet adherence, bringing around a significant amount of weight loss over the span of 3 to 6 months has known to reduce the requirement of medications, the dosages of medications, and in early diabetic patients it is also shown to reverse the onset of diabetes, but provided you are able to maintain and sustain the same pattern. But this is not applicable to everybody. In patients whose primary risk factors are related to this, they do tend to respond much better rather than people with advanced stage of diabetes. So people with a much more advanced stage of diabetes, dieting, your physical activity and exercise and lifestyle modifications do help control the progression of the disease, even bring about a reduction in the dosages and the medications required. But for the advanced diabetic patients, I don't think that we will be able to pull them off completely on medication, off the medications with diet and lifestyle modifications.
So sir, talking about diabetes and diet, are diabetic patients safe to follow these diets on their own, or should it be done under medical supervision?
Any diet in a high risk group is always safer to be strictly scrutinized or followed. Most of the incidents, there is no need for the physician to be directly involved with the patient per se, but a nutritionist should monitor the amount of calories going in, the patient calorie expenditure, and what is the kind of weight loss that they are looking at. The rapid weight gain or weight loss is not advisable because it will have deleterious effect. There is a rate at which we would like the weight loss to be on or the weight gain to be on, depending on what category of people they fall under. So any kind of diet requires your vital or your essential organ parameters to be monitored with a strict or close monitoring of the medical and the paramedical group, which basically involves your physician or your endocrinologist, your nutritionist, and somebody to check on your vital parameters regularly.
So moving on to the next question, we have Mr. Praveen asking us from Hyderabad. I was recently diagnosed with diabetes. Should I stop alcohol completely?
Alcohol does tend to have a little bit of deleterious effect on the liver per se. Alcohol also is very high in calorie content. So yes, if you are somebody who indulges in a significant amount of alcohol consumption on a daily basis or in a significant part or number of times in a week, you need to cut down on your alcohol base significantly. And if you're somebody who's recently diagnosed with diabetes, yes, stopping alcohol for the first 3 months very strictly would help your recovery to a certain extent, where the decision to add on further medications for diabetes management will be on the lesser side, or it will become easier to prevent the use of medications per se. Alcohol can be taken to a tune of 180 ml per week for a male and a lesser quantity for a female in terms of diabetes.
Do post us your queries on our social media network and we'll get them answered shortly. So taking the next question, we have Mrs. Deepthi asking us from Sangareddy. She says that her daughter is 14 years old and she was diagnosed with PCOS and she was put on metformin. So does that mean she's diabetic?
Young females with irregular monthly cycles and if they are on the heavier side or they're putting on weight very rapidly, clinically they do tend to diagnose them, apart from radiological confirmation, that they have a condition called polycystic ovarian syndrome. Polycystic ovarian syndrome is also associated with insulin resistance. So if the weight goes on unchecked in young females, the risk of insulin resistance and the PCOS tends to keep increasing. So it is out of this that endocrinologists or gynecologists tend to advise the use of metformin in them. And as per ACOG guidelines, a tune of 1500 milligrams per day is acceptable for the young females with PCOS. So it does not mean that they have diabetes, but it is to check their insulin resistance. So to break the negative cycle of putting on body weight, metformin is normally advised.
So sir, talking about PCOS and other metabolic disorders, how often should one do the diabetes screening in such patients?
Normally it is It is not a diabetes screening per se that we do in young females with PCOS. It is more of the clinical setting of how much of weight are they putting on and what frequency are you checking their body weight. We do tend to keep a check on the 3-month sugar average to a maximum frequency of 2 times in a year to check whether they are moving away from an insulin resistant state to a diabetic or overt diabetes. We also do check fasting insulin values or C-peptide levels to check if the patient is significantly under insulin resistance, so that insulin sensitivity or sensitizers medications can be increased in those particular category of people. The primary idea is that there should not be a weight gain in this group of young females. So if you're able to address that, I think the progression of diabetes can be controlled.
So sir, are there any specific precautions what the diabetic patients should be taking during this pandemic?
Yes, as we have seen, మన షుగర్ ఉన్న పేషెంట్స్లో బాడీలో ఇనేట్ ఇమ్యూనిటీ అనేది బాగా తక్కువగా ఉంటుంది. సో అలా తక్కువగా ఉన్నప్పుడు సాధారణ మనిషికి అంటుకోని జబ్బు మనకి అంటుకునే ఆస్కారం కూడా ఇంకెక్కువగా ఉంటుంది. షుగర్ పేషెంట్స్ గమనించారంటే వాళ్ళు మంత్లీ మెడికేషన్స్ కొనడానికి ఫార్మసీస్ కానీ అట్లాంటి జాగాలకి వెళ్ళే ఛాన్సెస్ ఎక్కువగా ఉంటాయి. అండ్ ఈ ఇన్ఫెక్టివ్ కానీ పాండమిక్ టైంలో సిక్ పేషెంట్స్ ఫార్మసీస్కి వచ్చే ఆస్కారం ఇంకెక్కువగా ఉంటుంది. సో హెల్తీ డయాబెటిక్ పేషెంట్స్కి కూడా అలాంటి జాగాలకి వెళ్ళినప్పుడు ఇన్ఫెక్షన్స్ అంటుకోవడం కానీ కోవిడ్ కానీ వేరే అంటుకునే ఛాన్స్ ఎక్కువగా ఉంటుంది కనుక మెడిసిన్స్ తీసుకోవడానికి కానివ్వండి, ఇలాంటివి వాళ్ళు డైరెక్ట్గా వెళ్ళకుండా ఫ్యామిలీ మెంబర్స్ కానీ యంగర్ మెంబర్స్ ఇన్ ద హౌస్ వెళ్ళి తీసుకుంటే కానీ, లేదా ఈ కామర్స్ సైట్స్ నుంచి హోమ్ డెలివరీ ఆఫ్ మెడికేషన్స్ కానీ పరీక్షలు చేసుకుంటే ఇట్స్ అ మచ్ మోర్ సేఫర్ ఆప్షన్. ఇంట్లో వాళ్ళ నుంచి కోవిడ్ అంటుకునే ఆస్కారం ఈ సెకండ్ వేవ్లో ఎక్కువగా ఉంది. సో ఇంట్లో కూడా చర్యలు ఇంకెక్కువగా పాటించాలి. డయాబెటిక్ పేషెంట్స్ కానీ హార్ట్ పేషెంట్స్ కానివ్వండి, ఇంట్లో కూడా మాస్క్ మెజారిటీ ఆఫ్ ద టైం ఫ్యామిలీ మెంబర్స్తో ఉన్నప్పుడు ధరించాలి. ఇంట్లో కూడా సోషల్ డిస్టెన్స్ అనేది మినిమంగా మెయింటైన్ చేయాలి. ఎస్పెషలీ వయసులో పెద్దగా ఉన్న వాళ్ళకి కానీ లేదా వేరే కోమోర్బిడిటీస్ ఉన్న వాళ్ళతో కొంచెం జాగ్రత్తగా ఉండడం అనేది ఉచితం.
So this brings us to the end of this session. Do post your queries or what topics you would like to discuss with our doctors here. We will bring them forward every Sunday. Do join us next week. Take care and stay safe. Thank you.